oral health literacy and oral hygiene habits in a Kentucky Appalachian community. This research study sought to identify the level of oral health literacy held by people who live in transitional and distressed Kentucky Appalachian areas, and if this affects how often they are using oral hygiene techniques. Data was also collected to describe the attitudes Kentucky Appalachian adults hold towards oral hygiene and oral health status. Current documentation shows that poor oral health remains a public health threat in this population, despite efforts such as school-based sealant programs and increased dental insurance coverage. This study followed a quantitative design, and there were 99 participants who were surveyed specifically using a survey developed for this study's purpose. Composite median scores and Spearman correlation values established the existence of a low oral health literacy level across the participant pool and documented that oral hygiene techniques are not used in frequencies recommended for proper oral health. A poor self-efficacy towards the ability to utilize these techniques properly was also identified. Results also found very poor self-efficacy towards oral hygiene methods, even though the participants expressed awareness of the recommended brushing frequencies and awareness of the benefits. They are not using oral hygiene methods. In addition, findings found that oral health status and related beliefs are similar across the region and not just isolated to the economically poorest areas, as the current available literature suggests. Applying the health belief model, it is predicted that Kentucky Appalachians are unlikely to adopt proper oral hygiene habits until their self-efficacy is improved. A recommendation from this study is that public health officials should promote personal control when designing public health programs geared towards improving the oral health status of this population. To do so would introduce a positive social change in the people with good oral health, and they would then be less likely to experience the pain, malnutrition, and negative social stigma that is associated with poor oral health. Future research needs to explore the reasons for poor self-efficacy with oral health habits, narrowing down the perceived barriers, and the reasons why people in Appalachia go to a dentist. Is it for preventative or for dental treatment? Nonetheless, people aren't brushing or flossing, yet these are the #1 self-prevention oral health methods, yet both behaviors are not being practiced.